In terms of talking about a solution to the difficulties that there now are, this is difficult. The reason is that there are many factors involved. The factors are clear enough. They range from policy making at central level with the politicians, right down to the way in which nurses and healthcare assistants on the ward approach their patients. But in between there are many, many issues. I think very generally, particularly now that we have a relatively new government, the overwhelming feeling is that governments are far too preoccupied with ideology, with structure, with sort of rather high-flown ideas about how they could make the NHS better, and indeed how they could win the next election, having spent 5 years trying to improve the NHS. One can't help feeling that whether it was New Labour 10 years ago, or whether it's the coalition government now, that they might have made a lot more progress with the health service if they genuinely concentrated on these most basic issues of dignified and humane care, rather than tack them on as an afterthought to the ideology and the structural changes which it seems governments of every colour pursue. That is a general point to make, but it does seem to me rather fundamental. Why talk about structural change? Why talk about the ideology of how you might run a health service when you can't even get it together to give patients food and drink, and you can't get it together to take them to the toilet or indeed give them pain relief?